Let's now shift our attention to the other big story that we are tracking on WION, where the Indian capital, Delhi, is experiencing a rise in the number of flu cases, particularly of Influenza B and H1N1, leading to respiratory infections. Now, according to a survey, symptoms like fever and cough have been reported in at least about 54% of all households in the national capital. Respiratory infections have been characterized by prolonged symptoms and persistent high fevers. A recent survey conducted by local circles revealed that fever, sore throat, cough, headache, stomach troubles, joint pain and respiratory problems are amongst the symptoms of H1N1 or swine flu. Now, these symptoms have been reported to be present in at least about 54% of the households in Delhi. And if these symptoms are left unnoticed, then it will lead to an increased risk of possibly pneumonia, bronchitis or even sinusitis. The survey has also highlighted that symptoms closely resemble those of COVID-19, and this has now fueled fear amongst the public. The survey has received about 13,000 responses from residents of Delhi, Gurgaon, Noida, Faridabad and Ghaziabad. Of the total respondents, about 63% are said to be men and 37% are said to be women. Now, doctors say that Influenza B and H1N1 viruses may affect people of all age groups, the elderly, the adults, the adolescents and even the kids. In particular, the kids and the elderly people are immunocompromised patients or people with any type of systematic disease such as diabetes, renal or chronic lung disease are also at high risk for serious complications. The survey has also found that small children and those above 50 are also at a pretty high risk of contracting these infections. Now, people have been advised to take precautions like covering their mouth and nose with a tissue while coughing or sneezing, washing hands frequently with soap and water and staying indoors if not feeling well, and refraining from touching eyes, mouth or nose. All right, now to give us more insights in terms of what is at this moment happening in the national capital, we are joined by Dr. Romel Tikku, who is the Director, Internal Medicine at Max Healthcare. Is joining us on this broadcast. Now, Dr. Tikku, the number of infections that are being noticed across the people in Delhi is a cause of concern. Now, how bad is this infection and how concerned should the people be, and what precautions should people be taking against these infections?
Well, we've been seeing a lot of patients coming with influenza-like illness for the last more than a month now. See, the only difference is that this time the strain is different, probably a mutated strain, which is leading to very high fever, and other symptoms like body ache, headache are also pronounced. Plus, it's leading to bronchitis, sinusitis, as you said, and in certain patients who are high risk, like the ones who are elderly or with comorbidities, with pneumonia. See, most of the patients are getting treated from the OPD, but some of them do need hospitalization. The ones who have respiratory failure needing oxygen need ICU care as well. So a lot of patients coming with these sort of symptoms. The only issue is that most of them, by the time they reach us, it's been 4 or 5 days and they've already had a course of antibiotics, which is not the treatment of a viral infection or flu. Most of them actually need an antiviral medicine called oseltamivir, which is available in India, which we do prescribe. Again, we don't have to test each and every person because we'll end up wasting a lot of time. See, when there is a surge of such cases, and we assume that most of the patients who have an influenza-like illness are probably positive for H1N1, H3N2, and we do treat them with oseltamivir. And we have to do it within the first 48 hours because that's when the drug is very effective. Still, you can have symptoms like bronchitis. Very few do end up with. A lot of patients actually this time have ended up with bronchitis, needing nebulization, inhalers. So see, the key is that the same thing, wear a mask, especially in crowded places, or if you're in a healthcare facility, wash your hands very often. If you are sick, stay at home. Don't go to your workplace and infect others. And if you happen to have people in the family who are sick, stay away from them. Maintain a distance. It's the same with COVID.
Right.
And why people are talking about COVID is because of the fact that these symptoms mimic sort of, even after recovery, there's weight loss, loss of appetite, loss of taste sensations, and so smell, and fatigue, and things like the headaches, and GI symptoms in certain cases. But there are not too many hospitalizations, deaths happening. This is certainly a cause of concern, but not to panic.
Right.
Because not too many hospitalizations happening and not too many mortalities.
Indeed. Now, in Delhi, a lot of people, in fact, say that this is fever, cough and other ailments that they suffer when the season changes. So at what point, should people actually come and see their general practitioner to get some medical advice? Because this may not just be an ordinary fever and cough.
Yeah, see, beyond 48 hours, for a day or two, if you have high fever, body ache, headache, you assume you have a viral infection. You can take paracetamol, you can drink lots of water, take rest. But if it persists beyond 48 hours, especially in the high-risk group, which is elderly or those with comorbidities, they should get in touch with their doctors. Don't self-medicate, don't take antibiotics, don't take steroids over the counter. Just get in touch with your doctors. They'll tell you what you need to do. Because the moment it's diagnosed early enough, then the chances of you getting complications are much lesser. And the ones who haven't had a flu shot in October, November, which is the right time to take it, they should take it now.
Right. Indeed. Thank you very much, Dr. Romel Tiku, for joining us with all those details there.
Thank you. Thank you so much.